Pregnancy and childbirth. Couples that are trying to become pregnant experience a range of intense emotions, ranging from joyful anticipation to overwhelming fear. Expectant parents find no shortage of things to worry about, such as the stress of caring for a newborn, how their own or their partner's body will change, and how their relationship will change, introducing a new life to the world. On the other hand, once the child is born, some parents report that the child significantly increases their level of happiness. Luckily, having a child nowadays is a much safer undertaking than it was before the advent of modern medicine. Science has certainly changed things. 80% of established pregnancies culminate in the delivery of a live newborn. Once born, a child has well over a 99% chance of surviving through its first year. Planned pregnancies typically produce healthier outcomes for both mothers and their infants. For the mother, planning includes a pre-pregnancy screening for STIs as well as for other medical conditions that could potentially harm a developing fetus. Optimizing health also includes the health of the man's sperm as well as the woman's ova. Avoidance of exposure to environmental hazards, including toxic compounds, radiation from X-rays, alcohol, drugs, and steroids, is particularly important as these can damage the integrity of the ova or the sperm. Since sperm require 9 to 10 weeks to develop, potential fathers typically are advised to avoid or limit these substances for 2 to 3 months preceding their attempt to impregnate their partner. We can examine the factors that lead to more optimal health outcomes for the baby once it is born. These include the mother receiving proper prenatal care throughout her pregnancy, and the couple educating themselves about how to care for a newborn infant. This education can be obtained by attending parenting classes, reading books, or talking to trusted sources. These factors are less likely to be present in the case of unintended pregnancies, possibly explaining why babies from unplanned pregnancies are at a higher risk of cognitive delays and low birth weight. When trying to conceive, many people become preoccupied with maximizing their chances of conception when they first are trying to get pregnant. Most doctors, though, advise that their patients try to relax and enjoy the process. Engaging in sex specifically to have a baby is a rare and special event. Couples often miss the beauty of this experience if they are anxious. The pressure couples place on themselves may even backfire as stress hormones flood their bodies, making conception less likely. There are some things that couples can do when trying to get pregnant. Estimating the timing of ovulation using calendar methods, changes in cervical mucus, cervical position, and basal body temperature. Couples can also use an ovulation kit, which will help predict when the female is most likely to get pregnant. Ovulation kits test when the LH surge occurs. LH is the luteinizing hormone that triggers ovulation. Couples can also increase their chances of pregnancy by ensuring coital ejaculation in the vagina once per each 24 hours during the 48-hour period around ovulation. They can also avoid contamination of the vagina with lubricants or douches that may impede sperm or adversely affect the pH of the vagina. Once pregnancy occurs, signs usually follow. The first sign is usually a missed period. The missed period is usually followed by nausea and fatigue caused by escalating levels of pregnancy hormones. Breast tenderness and mild uterine cramping can occur. Most females confirm they are pregnant either by using an at-home pregnancy test or through a blood test at their doctor's office. Both of these pregnancy tests measure human chorionic gonadotropin, or HCG. HCG is the hormone that is secreted as the embryo implants in the uterus. HCG levels increase quite dramatically in the days following conception, which is why a pregnancy test might measure negative one day and positive the very next day. Given this, pregnancy tests in recent years have become increasingly sensitive to rising HCG levels. Some tests now are able to detect pregnancy as soon as the first day that a female's menstrual period is late. A pelvic exam can also reveal other physical symptoms of early pregnancy. These are commonly referred to as Haggar's signs. Haggar's signs include a softening of the uterus and changes in the color of the cervix, vagina, and labia. Pregnancy will usually be confirmed with absolute certainty through the visual detection of an embryo and fetal heartbeat. Ultrasound can also confirm that the location of the embryo is indeed in the uterus and not in the oviduct. The implantation of the embryo in the oviducts is referred to as an ectopic pregnancy and requires medical intervention. The first trimester of pregnancy is often the most uncomfortable for the mother, especially in the case of a first pregnancy. Although not obvious to the outside world, the physical and emotional changes occurring within the mother are immense and at times can feel overwhelming. Optimizing the health of an embryo usually requires the discontinued or limited use of all substances and activities that could result in an injury to the fetus, including alcohol, nicotine, aspirin, recreational drugs, excessive vitamins, hot tubbing, steroids, and volatile fumes, such as those from paint thinners or gas. The first trimester of pregnancy is the most sensitive period of development, making this a critical time to completely eliminate such substances and activities. Once the egg is fertilized, it becomes a zygote, which is a single fertilized cell. As this single cell or zygote divides over the next couple of days, it becomes a blastocyst. The blastocyst contains an inner cell mass, which will later develop into the embryo. The inner cell mass is surrounded by a fluid called the blastocele. The outer layer of the blastocyst is called the trophoblast, and it will later develop into the placenta. At around day 20, the blastocyst moves out of the oviducts and down into the uterus. Between day 21 and 25, the blastocyst then implants into the endometrium, which is the inner wall of the uterus. At about day 26, immediately following implantation, the blastocyst will form the chorionic villi, which will sprout from the blastocyst's outer membrane to provide maximum contact area with the maternal blood supply. At this point, the blastocyst becomes truly interactive with and reliant upon the mother's body. As a result of the chorionic villi development, HCG levels will begin increasing, alerting the mother's body, as well as a pregnancy test, that a pregnancy has indeed occurred. For a period of 8 weeks past the time of fertilization, the corpus luteum continues to supply elevated levels of estrogen and progesterone, which stabilize the pregnancy. By week 12, at the end of the first trimester, the placenta will have developed and will serve to supply the main source of estrogen and progesterone for the remainder of the pregnancy. Relieved of its hormonal duties, the corpus luteum will proceed to disintegrate. The placenta connects the developing fetus to the uterine wall via the umbilical cord. The placenta allows for nutrient uptake, heat regulation, waste elimination, gas exchange, and protection against infection. Approximately 10 to 20% of known pregnancies will end in miscarriage. The actual number is likely much higher, well over 50%, because many miscarriages occur very early on in pregnancy before a woman even realizes she's pregnant. Some miscarriages involve a chemical pregnancy where the blastocyst implants and causes HCG levels to rise, but spontaneously aborts before an ultrasound can even detect a fetal heartbeat. According to the American College of Obstetrics and Gynecologists, chemical pregnancies account for 50 to 75% of all miscarriages. Many times this can happen with no physical symptoms and with the mother never knowing that conception has occurred. Usually, chemical pregnancies occur because of genetic errors in the blastocyst. In miscarriages that occur later in the first trimester, between weeks 10 and 13, the culprit is usually related to hormonal insufficiencies. As HCG levels skyrocket, the mother often experiences feelings of nausea, referred to as morning sickness. Despite its name, morning sickness can occur at any time of the day, with many mothers reporting that it intensifies when they are either fatigued or have an empty stomach. For some mothers, morning sickness is so severe that it causes intense vomiting and weight loss, which will require medical attention. The emotional responses to the pregnancy by the couple involved vary greatly. The couple may feel excitement and joy, or the couple may experience tremendous anxiety over changes taking place in the female body and the notion of now being responsible for the health and welfare of another human being. The couple might experience anxiety as they begin to consider the enormous undertaking of parenthood. The physical aspects of pregnancy are more apparent to the pregnant mother than to her non-pregnant partner, and consequently, her partner typically will take longer to conceptualize the pregnancy. For the mother, pregnancy is very concrete. Dramatic changes are occurring in her body, and she will sense that a fundamental change has occurred more quickly than her partner, for whom the pregnancy for a period of time will remain an abstract concept. Not surprisingly, the nausea and fatigue that frequently accompany the first trimester of pregnancy can greatly interfere with the mother's libido. At the same time, feelings of love, joy, and closeness may stimulate sexual desire, especially if the physical symptoms of the pregnancy are not overly severe. In cases where the relationship is threatened by the pregnancy, or where ambivalence about its existence colors the relationship, sexual desire is likely to be inhibited. For most females, the second trimester is the most enjoyable trimester of the pregnancy. The second trimester occurs between weeks 13 and 24. Morning sickness usually disappears during this stage. Energy is plentiful, and she begins to look and feel more pregnant. By week 12, the placenta has developed to a point where it is now almost the exclusive producer of estrogen and progesterone, the two hormones that stabilize the pregnancy. By 16 weeks, fetal development has progressed to the point where the mother will begin to feel kicking inside her uterus. This phenomenon is known as quickening. Quickening can elicit feelings of incredible excitement and joy as the mother begins to experience her pregnancy much more concretely. The mother can also provide an emotional high to her partner by allowing him or her to feel the physical evidence of the fetus associated with the quickening. Other physical changes at this time include the production of colostrum in the breasts. Colostrum may begin to be secreted in extremely small amounts around the mother's areolae. Colostrum is yellow or gold in color, and it is the first indication of the milk that will provide nourishment to the baby when it is born. The fetus grows tremendously during the second trimester, and as a result, so does the mother's uterus, which will ultimately enlarge to 60 times its original size. As it grows, the uterus will push all of the surrounding organs up into the mother's abdominal cavity. As the stomach gets compressed, many females report that they are unable to eat large meals. Instead, they eat smaller meals more frequently throughout the day. The increasingly large and heavy uterus can also increase the need to urinate, given that its positioning is immediately on top of the bladder. Another effect of the growing pregnancy comes in the form of vascular changes. There is a tremendous increase in blood volume flowing through the mother's body. This often leads to water retention, a condition called edema, which causes swelling of the hands and feet. At some point during the second trimester, some type of fetal testing is usually performed. This includes the quad or quadruple test, which is done between weeks 15 and 22 of the pregnancy. The quad test measures 4 different substances in the blood. It screens for Down syndrome, trisomy 18, and neural tube defects. This test is usually combined with an ultrasound, which can also help detect signs of these conditions by taking specific measurements of the developing fetus. For women who are of advanced maternal age, usually defined as 35 or older, or who are otherwise at higher risk for having a child with genetic disorders, cell-free DNA testing allows an examiner to look at small particles of DNA that shed off from the placenta and circulate in the mother's blood. These tests screen for Down syndrome, trisomy 13, trisomy 18, and problems with a number of sex chromosomes. A positive result in the quad test or cell-free DNA test will usually require an amniocentesis to confirm the results. This test requires that fetal DNA be extracted from the amniotic fluid in the sac surrounding the fetus. It is performed using a large needle that is inserted into the uterus from the abdomen that then extracts fluid. Amniocentesis is an invasive procedure that carries a small chance of causing pregnancy loss. However, this chance is under 1%. The second trimester is usually a time of emotional and physical well-being relative to the other phases of pregnancy and postpartum period. As morning sickness subsides, the female usually resumes interest in her previous activities and feels happy to get back to a more normal way of life. With the risk of miscarriage mostly behind her, the mother may experience a sense of relief at having made it through the hardest time of her pregnancy. Females often report feeling especially attractive and energetic during the second trimester of pregnancy. As progesterone and estrogen continue to rise, oil production will slightly increase, affording many females that pregnancy glow that translates into dewier skin, shinier, thicker hair, and stronger, faster-growing nails. As sensations from quickening continue to intensify, the female is likely to begin identifying herself as a mother and the fetus as a baby. As the female continues to feel better and more energized throughout the second trimester, libido often returns. In fact, many females report a heightened interest in sex and more ease in reaching orgasm as blood flow increases to the genital regions, causing a state of mild chronic engorgement. At the same time, many females experience a heightened sensitivity to their changing shape. As the breasts, buttocks, and abdomen enlarge, some females experience anxiety about their own attractiveness and erotic capability. In addition, a fear of hurting the fetus via sexual intercourse, though unfounded, causes many couples to limit their sexual activity and occasionally to withdraw from sex. Most couples, however, continue to engage in sex well into the 9th month. Most females continue to feel good for the majority of the 3rd trimester. As the fetus continues to grow and the fetus puts on weight, dramatic changes will occur in the mother's body. The 3rd trimester occurs between weeks 25 and 40. In general, females are advised to gain between 25 and 35 pounds during the pregnancy. Most of this weight is gained in the 2nd and 3rd trimesters, when the recommendation is to gain roughly 1 pound a week. Only 3 to 5 pounds needs to be gained in the 1st trimester, when the fetus has yet to put on any meaningful weight. During this time, dramatic enlargement of the uterus causes even more pressure on the female's internal organs. This can lead to shortness of breath, indigestion, back pain, constipation, hemorrhoids, frequent urination, heartburn, and urine leakage. Significant edema can also cause intensified swelling of the hands and feet, as well as the legs and face. As blood volume continues to increase, issues with high blood pressure can arise, giving way to hypertension or preeclampsia. Between week 34 and 36, the head of the fetus turns downward and moves lower into the female's pelvis. At this point, the fetus is said to be presenting. This leads to a relief in pressure above the uterus, but an increase in pressure below, primarily on the bladder. At around 36 weeks, most females begin experiencing Braxton Hicks contractions. These are generally painless and usually feel like a belt being tightened for a few seconds around the mother's lower abdomen. Braxton Hicks are literally the uterus practicing and preparing itself for labor and delivery. They typically become more frequent and strong during the last couple of weeks of the pregnancy. During the last few weeks of the 3rd trimester, fatigue and discomfort tend to set in as a result of disturbed sleep and enormous weight gain take their toll. Understandably, most females at this point feel ready to be finished with the pregnancy. During the last several weeks of the pregnancy, the primary emotional response is a desire for the pregnancy to be over. Although the couple may feel this way, week 32 onward marks a critical time for fetal development, as the lungs and the ability to breathe outside the womb are finely tuned. It is not uncommon for couples to experience renewed anxiety concerning the health of the fetus, as well as about the birth itself. Most women fear to some extent the pain that will be involved in delivery, and their body's ability to handle and recover from the process. In addition, fear of becoming a parent and one's overall readiness for the role usually escalates as the reality of having a baby approaches. Many females may become increasingly or unusually possessive of their partner, and a heightened need to feel in control. Most couples report that bodily changes and fatigue at this point in the pregnancy begin to interfere with sexual activity. Usually, this requires changes in coital positions that will allow the female to feel comfortable and relax, and that will remove pressure from the abdomen. An increasing awareness of a new person also changes the sexual experience as a sense that a third person is present. Fetal movements tend to increase during and after sexual stimulation and orgasm, and usually both the female and her partner will sense these movements easily. Many couples also fear that sexual activity will harm the fetus, although this fear remains to be unfounded, even through the very end of the 3rd trimester. This being said, There are some conditions in which it is a good idea to discontinue having sexual intercourse in the third trimester. For example, if the female experiences pain or discomfort, or if there is a discharge of mucus, as this could be a signal of loosening of the mucus plug, signaling that the woman is about to go into labor. The appearance of blood and amniotic fluid can also be signs of labor, and the onset of labor contractions will be far more intense than the Braxton Hicks contractions. The definition of full term when it comes to pregnancy has changed over time. The answer to this question was once 37 weeks. In 2013, however, the American College of Obstetrics and Gynecologists refined the definition of a full-term pregnancy based on research indicating that babies born at 39 weeks, as compared to those at 37 weeks, have a better chance at optimal health and are at lower risk of having cognitive and physical impairments. Early term is now defined as between 37 and 38 weeks. Full term is considered between 39 and 40 weeks. Late term is around 41 weeks, and post-term is beyond 42 weeks. The point of such definitions is primarily to emphasize to doctors that even an extra week in the womb can make a difference for a newborn, and that planned C-sections should not occur before 39 weeks unless they are medically necessary at the time. As these definitions imply, neonatal outcomes depend more heavily on weeks in utero than on physical size and birth weight. The table shown here shows the chances a baby has of surviving based on when it was born. This data is courtesy of the March of Dimes. That being said, there are certain risks involved with a post-term birth. Although many doctors used to allow females to progress to 42 or even 43 weeks, this stopped being the case as the associated risks became better understood. The primary problem is that at a certain point, the placenta fails to provide adequate nutrition for the fetus, leading to low birth weight. On the other hand, a larger post-term fetus increases the chance that a cesarean section or C-section will be necessary for delivery, which carries a higher risk than vaginal delivery. Due to these factors, most doctors will use a drug called Pitocin to bring on contractions and induce labor once a female is at or past 42 weeks. The most prominent sign that a female is going into labor is strong sequential uterine contractions. Other signs include the discharge of a mucus plug, the appearance of blood in the vagina, called the bloody show, or the leaking of amniotic fluid, called the breaking of the water. Many times these other signs are skipped, however, and labor begins simply with the onset of very strong uterine contractions. These contractions will grow increasingly intense, longer, and closer together as delivery approaches. The process of going into labor begins weeks before the actual birth, when the fetal adrenal glands secrete a surge of hormones. These hormones serve to accomplish two important goals. First, they cause the lungs of the fetus to fully mature so that they are able to inflate with air and absorb oxygen after birth. At the same time, these hormones trigger the mother's pituitary gland to begin secreting oxytocin. Increasing oxytocin levels eventually triggers the release of prostaglandins in the mother's uterus, which in turn causes the uterus to begin contractions. As the uterus contracts, it pushes the baby's head towards the cervix. Nerve impulses from the cervix then stimulate the mother's brain to produce even more oxytocin, and the entire chain of events repeats again in an increasingly intensified positive feedback loop. Labor is divided into 3 stages: Stage 1, Stage 2, and Stage 3. During Stage 1, contractions of the myometrium cause the cervix to soften and dilate, eventually to the width of 10 centimeters. On average, Stage 1 lasts between 12 and 15 hours in a first pregnancy and 8 hours in later pregnancies. During Stage 2, the fetus is expelled from the mother's body. This can take anywhere from a few minutes to a few hours and usually is accomplished through controlled pushing or bearing down. In Stage 3, the placenta or afterbirth is expelled. This usually takes about 30 to 60 minutes and is usually not even felt by the mother. The weeks after birth are called the postpartum period and include the physical recovery from the stresses associated with pregnancy and childbirth. Physically, the mother's body has completed a Herculean task and requires rest and proper nutrition to recuperate. For several days after birth, dark bloody discharge known as lochia continues to be expelled from the vagina. This discharge becomes smaller over time and then ceases. The mother's uterus and abdomen, still swollen and stretched, will continue to shrink in size. This process is usually aided by breastfeeding, which burns fat and also causes the uterus to shrink. Most mothers require at least 6 months until they are back to their pre-pregnancy shape and size. Psychologically, the postpartum period often involves a roller coaster of emotions. For the first several days, most mothers feel exuberant over the arrival of the new baby. With the stress of childbirth behind her, a new mother often has a sense of accomplishment, coupled with newfound feelings of closeness with her partner resulting from the importance of the shared experience. Other mothers never experience this high, especially if the birth experience was not what they had anticipated. These mothers may focus primarily on the fear or loss of control they experienced, or the sense that they were denied the experience they had so eagerly anticipated. For a very small percentage, the birth even lead to post-traumatic stress. Even for the mother who experiences an initial high, a period of enormous stress usually follows once she finds herself back at home and struggling to learn how to take care of her new child. Changing the baby, learning to breastfeed, getting the baby to sleep, and learning how to soothe her newborn infant, exceedingly exhausting and overwhelming, especially for a first-time mother who is still tired and recovering from the birth process itself. During this period, it is critical that new mothers receive support from their partners, other family members, and friends. For females who receive the support and help they need, the experience can be a wonderful, magical time during which they get to bond with their new infant. Mothers who receive little or no help, however, are likely to be severely exhausted and are at high risk for developing depression. The vast majority of women, 70 to 80%, experience at least some sadness and crying in the postpartum period. This phenomenon is referred to as baby blues. The stress of caring for a newborn while recovering oneself from childbirth cannot be overestimated, and the precipitous drop in pregnancy hormones, progesterone and estrogen, following birth only intensifies such feelings. Fathers can also experience postpartum depression. Research suggests, in fact, that maternal and paternal depression is linked and are both exacerbated by a shared lack of spousal support and the corresponding drop in the relationship satisfaction. About 1 in 7 mothers experience a sadness that is so intense and prolonged, it is referred to as postpartum depression. Susceptibility to postpartum depression usually peaks between 10 and 20 days after birth. A woman who does fall victim to postpartum depression will often suffer for several months after she has given birth. A very small number of females experience postpartum psychosis, in which depression becomes so severe that it leads to disordered thinking. In very rare cases, this disorder leads the mother to commit suicide or infanticide. What makes a woman most at risk for postpartum depression? Psychosocial factors obviously play an important role. Single mothers are at a far higher risk than mothers who have partners who can help and support them. Also, females who are especially sensitive to estrogen, which drops following childbirth, are more likely to suffer enormous hormone fluctuations that occur. Treatment for postpartum depression includes estrogen treatments and antidepressants. Breastfeeding provides the perfect food for babies. Breast milk provides nutrients like fats and proteins, provides antibiotics, it is the perfect temperature, easy to digest, and provides protection from diarrhea, respiratory infections, urinary infections, and viral infections. Colostrum, which is the highly concentrated gold-colored fluid that is first secreted by the mother's breasts, contains a sufficiently high concentration of antibodies that will provide the infant with complete immunity until the infant can develop its own antibodies to fight pathogens it will encounter. Breastfeeding also carries positive benefits for the nursing mother. Suckling of the breasts causes the mother to secrete oxytocin and in turn prostaglandins, which speed recovery and shrinking of the uterus. The hormonal state supporting lactation also reduces the mother's risk for ovarian and breast cancer. Lactation is a high-energy activity, meaning that it helps to burn fat stored during the pregnancy. thereby enabling the mother to return to her pre-pregnancy weight more quickly. It also prevents pregnancy, since the hormones involved in lactation essentially cause a suspension in ovulation. Despite its benefits, breastfeeding has some disadvantages. First, breastfeeding takes a long time, often several hours each day, especially in the first days after birth, when it can be challenging to keep an infant awake long enough to ingest an adequate supply. Because only the mother can easily feed the infant, this time commitment can severely limit both her daytime and nighttime activities, including work and sleep. Breastfeeding can also make fathers feel sidelined since they are not as easily able to feed the infant. Breastfeeding can also be painful. Nipples can become raw and cracked. Also, breast milk can pass on pathogens from the mother to her infant, including HIV and hepatitis. Couples often enjoy a newfound sense of closeness following the arrival of their newborn. However, the exhaustion of caring for a newborn can invite negative feelings. A father may start to feel jealous of the infant taking all of the mother's attention, and a mother may resent her partner's relative freedom. Sexually, couples are advised not to engage in coitus until the woman has physically healed from childbirth, which usually takes about 6 weeks. The exhaustion that comes from caring for a newborn usually dampens any interest in sex. Nursing mothers have high prolactin levels, which suppresses libido. Lower levels of estrogen causes diminished vaginal lubrication, making coitus painful. Psychologically, some women suffer from a feeling that pregnancy and birth have reduced their attractiveness and thus their ability to enjoy sex and satisfy their partner. These fears are unfounded, of course, since weight can be easily lost even if the mother is breastfeeding, and even if the weight is not lost, the mother remains attractive anyway. Regardless, the mother's anxiety about her body and role often contributes to her lack of enthusiasm for sex. Within a few months, most couples return to having sex, although usually with less frequency than before birth. Marital satisfaction also frequently declines for reasons stated here. This is not always the case, however. Many relationships do thrive and in fact blossom with the addition of the child. For those who struggle, gaining an understanding and awareness of how the dynamics shift once a baby is born can significantly help overcome these challenges. Thank you for watching.